Welcome to Shift Report, the podcast brought to you by mcentric.com. mcentric is the go-to information and resources hub designed exclusively for the emergency medicine community. On each episode of Shift Report, we host key leaders from the field who share their insights and experience from inside the world of emergency medicine. Our goal is to inform you, to encourage you to use what you learn to improve your practice and to improve yourself. Today, we welcome Eric Ossmann. Dr. Ossmann practices in Greenville, South Carolina. He received a medical degree from Southern Illinois University and trained in emergency medicine at Indiana University. Today, he'll focus on challenges related to healthcare and safety while traveling from his long-standing experience as co-founder and chief medical officer of Vigilant, while sharing some insights on how he manages the hectic mix of clinical and non-clinical roles we know so well. Welcome, Eric.
Thank you, Till. Happy to be here.
Thank you for taking the time to share some insights with us today. And you have a wide range of experience in emergency medicine, still at the bedside, and as many of us, and in other outside activities. And we want to focus on a number of those today. But first, for everyone, what led you to emergency medicine as a specialty?
Well, I mean, it was sort of a fortuitous event. I took an EMT class really on a whim because it was one of the few classes that was available when you had to do winter term where I went to college. And at that point, I was a business management major and didn't really know much about medicine. Had an opportunity to work with a rural EMS service, and then had an opportunity to advance and work in an urban EMS environment, and found it really fascinating and changed my career course.
That's great. It's interesting talking to many leaders and finding out all the different pathways to get to emergency medicine. So thank you for sharing that. So along the way, between medical school, residency, and perhaps in other areas, we've all had some mentors who made a big difference in our lives. And who were a couple of yours, and what did they do to lead you to where you are?
Well, I think there are a couple mentors I've had throughout my life, but early in my career, one of my primary mentors was Dr. Jamie Jones, who was my assistant residency director at Methodist, Indiana, when I was a resident. Jamie was actually the medical director for one of the EMS services I worked for as an EMT. And he really impressed me with his depth of knowledge and his ability just to remain cool and unflappable in almost any situation. He, consummate clinician, consummate gentleman. And Jamie taught me a lot about how to be a professional emergency physician. Carrie Chisholm was the residency director when I was at IU. Phenomenal clinician, one of the best clinicians that I've ever known, and a great teacher. And really taught me the value of curiosity, which I think is one of the key elements of an emergency physician's career, is to remain curious. I mean it's every day you're presented with new and different things that you've never seen before, and curiosity, I think, is what sustains you in the long term. So those would be the two mentors that I would think about the most from that point in my career.
Those are great points, and it's similar to many things we hear about role models showing great clinical skill and also skill to manage pressure, and the curiosity you mentioned is an interesting point, and really key to lots of us in emergency medicine. So beyond your bedside practice and your local leadership in several different places you've been, you started a company called Vigilant and focus on individual and organizational preparedness, and have been doing that for a number of years. So tell us a little bit about what you do with your team at Vigilant, and how this has developed.
Sure. Well, it started really at Emory University. There were several of us that had EMS and operational medicine backgrounds that really felt like there might be a use for operational medicine outside of just being an EMS medical director or providing medical oversight to local sporting events. We had encountered people in the corporate environment who were traveling internationally and were like, "Hey, I don't understand what the medical system looks like wherever I'm going, and can you help me with that? Or, what should I do if X happens?" And so that was really what kickstarted it. And fortunately, Arthur Kellerman, who's an incredible, physician leader, was our chairman at the time, and Arthur gave us the green light to go ahead and start this, and so we did. And then after several years, we moved that outside of Emory and began focusing on the commercial and government market, really with the idea of providing operational support. And that could be medical oversight, medical direction. It could be telemedicine. It could be, putting a physician on the ground or a paramedic provider on the ground with a team, and then also advisory services, because we found that there were a lot of commercial clients that needed a fractional component of a chief medical officer's time. They didn't, certainly don't need a chief medical officer, but they on occasion need advice, and usually that advice is time sensitive and needs to come with a certain degree of expertise. And so those were the areas that we focused on, and we've continued to focus on that as we've grown the company.
That's a fascinating start, and I think with many stories of entrepreneurship and starting new operations, I think it starts with good clinical medicine, and that's a story we hear over and over again of providing good clinical and medical advice from a good basis, and that sounds like what you did. I'm not certain how to ask the question properly because you probably don't have a typical client. They're all different, I imagine. But what is your typical client, or what are the things you're typically asked when you discuss what you do?
So, we have clients that range really from government clients, and most of those typical clients are entities that require some degree of medical support, either telemedicine or direct medical support in an austere environment. And so that group is pretty straightforward. They're in places where good medical care doesn't exist, and we are one of the mitigation measures that gets put in place. On the commercial side, the client base is really varied. I would say one of the key elements for our commercial clients is that they're typically very focused on employee and team member wellness and well-being, in that they care a lot about taking care of their people, and so they want to be very aware of what are the medical resources in a number of different locations, both domestic and international, and they want to be able to support people when they have either an accident or an illness. And then the other element, really on the advisory side, is companies that see risk mitigation in the healthcare space as an important activity. I think I think that we learned during COVID. There's suddenly mitigation of an infectious disease risk became important to everybody, but now that COVID has died down, I think a lot of folks have forgotten about the importance of just the interpandemic or inter-event preparedness.
That's great insight. So you have built and now operate with a number of partners a large organization, Vigilant, and so you likely face sort of clinical challenges and business challenges. What are some of your biggest challenges, and how does your experience in emergency medicine help you handle them?
Well, I think our biggest challenge, and stepping back a piece, we are at our core a medical practice, and we've got over 240 providers, on staff, ranging anywhere from emergency physicians to trauma surgeons to anesthesiologists to nurses to tactical paramedics, and maintaining that kind of infrastructure takes a lot of back office help as well. So our biggest challenge is striking that balance between being flexible, nimble, dynamic, able to respond in a timely fashion when clients have requests, be they operational or advisory, and doing it in a financially efficient way. I mean, I think that is our largest challenge is striking that balance, and that's probably no different than most medical practices, I would assume. And then I would say our second challenge is really explaining what we do and what value we can bring to the table. There are a lot of medical services out there that support international travel, and there's a lot of marketing around them, and the public generally struggles to understand what they're really getting, and so differentiating ourselves in that space is always a challenge.
So we've talked a bit about your organization, and it's really a fascinating organization to learn about. Sort of, you mentioned the public as looking for information and not really knowing what to do in many cases. So your clients face health risks related to foreign travel. So what do you tell individuals and families about assessing their risks around the world related to personal travel?
But I think the first step is just a risk assessment. If you know where you're going, understand the medical system there. What's available to you, and just a basic understanding of how it works. And in many areas of the world, there is a public-private type medical system construct, which is somewhat different than what we might encounter in the U.S., where everything we're really dealing with is in the private sector in medicine in healthcare, and so understanding that, and then two, I think understanding what sort of emergency response capabilities or mitigation measures you have in your back pocket, and that might be international travel insurance you've purchased. It might be your existing health insurance. It might be a membership air medical evacuation program. But understanding what are the tools that you individually have to leverage if something goes wrong and you need healthcare.
So and there are many grades of foreign countries or types of foreign countries. There are very urban and sophisticated environments, and there are environments that are not so sophisticated. So just in general, if you're seeking medical care in a foreign country, and you're a U.S. traveler, what do you need to know that may not be obvious if you haven't traveled frequently to those places?
Well, I think that gets down to, understanding how their healthcare system is constructed. Sometimes you'll have services in the public sector in a foreign country that are not available or not available in as high of a quality in the private sector. And so understanding, where to seek care and what to seek care for are really important. Oftentimes, we'll provide clients with a medical brief on a destination that they're going to. And, we'll have several hospitals on that list that are preferred facilities. And oftentimes we'll break it down based upon what your needs are. And oftentimes that's not totally obvious. The other thing that I would say, when traveling internationally, is most of these hospitals require payment up front. That oftentimes is pretty shocking to Americans who, are pretty familiar with just going into a hospital, and if care is needed, care is provided, and then they sort of figure out the billing on the back end. Oftentimes, people will be asked for a credit card up front, and before say every expensive test like a CT scan or potentially an MRI, they're coming to you and saying, well, okay, we're going to now charge you this. So a little bit of a different setup than what we're familiar with, and something to be prepared for.
From a travel preparedness standpoint, you've mentioned cost and money, and you mentioned insurance, and as one is looking at travel, which most people travel for 1 to 2 weeks or so, and there is longer travel, but just for the typical 1 to 2 week trip internationally, you can search on the internet for insurance and find all sorts of references to health and trip interruption and evacuation and repatriation. So there are lots of types of insurance. So what are the considerations when you advise people on getting commercial insurance What do you look for in a policy? What do you look for in a carrier? And what do you need to have covered?
So I think you first start looking at your own health insurance, and many U.S. plans do not cover emergencies, illness, accidents, when you're outside the country. And so, you want to look at your own rider and determine whether or not you have that coverage, because that's really the first step. Is we're talking about episodic travel, where you're not establishing primary care, but you want to make sure you're covered if you get in an accident or you have an illness and you have to use the local healthcare system. If your current policy does not cover that, then you definitely want to look for like an international travel medical insurance policy. And usually these policies are bundled in that they'll cover emergency care, for accidents and illnesses. They'll typically cover trip interruptions, and they'll usually have some type of air evacuation coverage built into them. And then there's a number of other features, that they'll all have, like, payment for lost luggage and some other things. But the key is start with your own policy. And if you see a gap, if you see that you're not covered outside the United States, then definitely, look at international travel medical insurance. And there are a number of providers. AIG is probably one of the largest. They all offer a relatively similar product, but that's a great place to start. And the cost for that is typically pretty low. For like a 2-week trip, you're probably talking $100 or so, so not terribly expensive.
That's great advice. Thank you. So when you're planning international travel, what do you need to take with you, and how do you consider the differences if you're going to a developed area versus a less developed or sort of adventure type area?
So I think, first of all, make sure you take your own medications and then a backup supply, right? Because you don't know if the trip will be interrupted, et cetera. That's the first step, and you need to be aware of what you can bring into certain countries. There are many countries that do not allow importation or use of certain scheduled drugs that we would commonly have in the United States. And so making sure that you can actually bring your medicine in, or what the procedures are to bring that medicine in, is the first step. The second thing, that I would say, there are a number of basic things you should probably always have with you. Rehydration solution or salts, always important to carry, very, very lightweight. Mosquito repellent, sunscreen, all the basics. And then going beyond that, based upon your risk and your desire to mitigate that risk, carrying some medications that you're not taking, but you might take, such as medications for a gastrointestinal illness, for nausea, for vomiting. Those are all key elements. And on the vigilant side, we actually have a fully licensed pharmacy in house, and one of the services we provide, both on the government and the commercial side, is we provide people with travel medical kits, so that they always have medication that they would need. And we do this for a couple of reasons. One is convenience. It's sure a lot easier to call our telemedicine center, talk to our physicians, and get treated right out of your kit than to try to seek care in a foreign country. And two, it's the provenance of the medications. You know what you're getting. Sometimes in certain places, medication counterfeiting is a big deal. You don't know what you're getting when you go to the pharmacy. So having your own supply sort of bypasses those risks.
So this is all great advice regarding travel. You continue to practice in a busy clinical environment in South Carolina, and face many of the challenges that our colleagues face in the practice of emergency medicine, not just over the last few years, but before that and now. What do you want the public to know about the challenges that are facing emergency medicine and broadly defined today?
Well, I think what I would say is probably no different than what you would say or many physicians say. Is I don't think the public understands how tenuous our healthcare system really is right now, as far as its ability to provide both acute care and then primary care for the population. Tragically in the U.S., we spend more than any other developed country per capita on healthcare. Yet, access to primary care for most people, even with good insurance, is limited. A lot of this falls back into the emergency departments, which are in almost every area of the country horribly overcrowded. We know that overcrowding and ED boarding leads to safety events, leads to poor health outcomes, and yet this continues to get worse. So I think people need to understand that the system is not in great shape, and will require quite a bit of intervention to get it into any sort of functional status. That being said, I mean, emergency medicine continues to be an amazing specialty that's able to provide, care in really challenging environments, in the hallway of a lot of hospitals, with very limited resources or assistance from other specialties. So I'm incredibly proud of what our colleagues, do in the emergency department, but oftentimes I feel like, we're sort of the last bastion protecting the public, and everybody else is sort of left the party.
So you lead and have led groups of providers, physicians, NPs, PAs, residents, students, paramedics, EMTs, who all face, whether you call it burnout or workplace stress or whatever term gets applied to it, are facing that now in increasing numbers and leaving medicine. What advice do you give to providers about taking care of themselves in a difficult and stressful environment?
Well, I think number one is there has to be some other motivation for practicing emergency medicine than money or the salary. I think that becomes a dangerous trap people fall into. They get used to a certain level of income, and they get to a point where they're not able to do 16 to 18 shifts a month because it's killing them and it's affecting every aspect of their life. But they can't drop down to 10 shifts a month, because of the sort of the monetary needs that they have. So number one, I would say is make sure to live below your means and not view maximizing your emergency medicine salary, as a source of happiness, because I've never seen it be a source of happiness for anyone. The most precious thing you have in life is time, and being able to spend time with your family, being able to spend time on hobbies that you enjoy, being able to spend time traveling, those are all things that have immense internal value to most people, and I think alleviate a lot of stress. So focusing on that is really important. And then finally, I would say stay curious. Enjoy the specialty. The reality of daily emergency medicine is it can be pretty frustrating, and if you focus on the frustrations, I think you develop a lot of negativity towards the practice, and it becomes just a vicious snowball. Stay curious. Learn throughout your career, and be interested in your patients, be interested in your colleagues, and realize you're doing a great service in your community. And I think those are the ways you stay mentally healthy throughout this.
That's great advice. And before we close, please remind us how to find Vigilant and find out more about what you do in your organization.
Sure, very easy. Just go to the web and www.vigilance, spelled vigilint.com. We're there, whether you need us for assistance with travel or medical advisory, or you're interested in maybe working with us. Check us out.
Thank you, Dr. Eric Ossmann, for your time today.
Thank you, Till.
And thank you for joining us in this episode of M-Centric Shift Report. A special thanks to Dr. Ossmann for sharing his important insights. For more content, networking, and innovation in the world of emergency medicine, please visit mcentric.com.